Good morning, everyone. My brief today is to talk on insights for healthy living. I, being an orthopedic surgeon, have been given this topic to talk about how to move strong and live long. My name is Vaibhav Bagaria, and I work as the director of Sir H.N. Reliance Foundation Hospital Orthopedic Department. And I welcome you all to this wellness program. And first and foremost, thank the chairperson and the organizers for giving me this opportunity to present on this subject. Now, while we look at this video here, which shows how we age over time, I think we all must pause and reflect is that what is our greatest fear about living long enough? And to all people I have asked, the number one answer is that they all want to die suddenly. They don't want to be unhealthy on a ICU and dying. So I think all of us want to live longer, but also to die younger. Contrarian words, but in effect it means that we all want to prolong our life. But when we die, we don't want to die in a debilitated condition. And we all know that, like rivers, time flows, carving the paths unseen, and in its silent passage, life finds its sheen. So let's look at how we can live to 102 not out. This is a very important slide, and I think it epitomizes everything that we should do to live longer, live happier, and live healthier. And one of the key element of this you can see is exercising and taking care of our body. When we are born with abundant energies, and the God has given us infinite source of the enthusiasm, the strength, and the musculoskeletal well-being. But as we age, our mobility and strength gets affected, and these are the statistics. There is a 3 to 5% muscle mass that is lost per decade after the age of 30 years. By the age of 60, it is accelerated, and by the age of 80, 30% of it is lost, impacting our strength, balance, and ability to perform daily tasks. Bones undergo a similar change, and after age of 50, there is 15% loss, or there's 1.5% per year loss. That's a mistake here. 1.5% lost per year. And when you look at the numbers of falls and fracture, 30% of people over 65 experience one fall each year. It's a staggering number, and it only keeps getting worse. These falls account for 95% of hip fractures, and sadly, 20% of these people will die within a year due to some complication. These complications may not be solely related to the fracture, but the fact that they have developed the fracture means that something wrong is going on with their body. There's a famous saying that we had in our surgery books, and they say that we enter through pelvis and leave through pelvis. And this is true for many of, or at least 30 to 40% of our patients, that they will, we of course are born through pelvis, but will die because we have had a hip fracture. Now, the impact of age on musculoskeletal is not just on these thing at the terminal stage, but also on the quality of life. The mobility limitation leads to 70% higher risk of hospitalization and overall 40% decrease in life satisfaction. The walking speed can start to decline and declines 12 to 16% per decade after age of 60, and by age of 75, 30% people report difficulty in walking or climbing stairs, impacting their ability to live independently. So while we are young, we are enthusiastic, time weighs on us, we become slow, and worse, we lose balance. Physiologically, what happens when we age? So bones, there's loss of bone density due to decreased calcium and mineral content, and this is known as osteoporosis. Particularly concerning areas are spine, hip, and wrist. Muscle also, which are responsible for power and supporting joint, show a reduced muscle fiber size and the changes in muscle protein. And joints wear down and the fluid lubrication decreases, leading it to become stiffer and painful. So if you look at these bones, This is how the normal bones, you'll see that they are dense, but as the osteoporosis happens, you'll see that there's a lot of lacunae there, and the overall mineralization decrease. Similar thing happens with muscle, where there is a muscle bulk as well as the tone, the strength, and the quality of muscle decreases. The joint tend to wear off, leading to arthritis and spur formation, decreased mobility, pain, which is a constant source of discomfort. So, what can be done? And I think the first and foremost thing is to understand what exercises should we do. When we look at overall exercises, there are 5 categories of exercise. The first is weight bearing exercise. These are important for strengthening your bone. The second is strength training. These are for muscles and bones. Third is the flexibility exercise, which are for joint health. Fourth is the balance exercise, that's primarily to prevent fall. And last but not least is a low impact aerobics, which is for joint friendly cardio health. So let's look at each of them one by one and understand what is needed to be done. So weight bearing exercises are simple, where your body or your joints take the load. They could be walking, jogging, skipping, and dancing. So this is the first, easiest, and more fun-filled thing. The thumb rule is to do what you enjoy. You can choose any of these. Okay. The second one is the strength exercise. So one must incorporate certain degree of strength training. These could be in form of therabands. One can do squats, lunges, or push-ups. The number 3 category is the flexibility exercise, where you have to stretch, yoga, pilates. Just ensure a good joint mobility. The fourth is the balance exercise, which could be a single leg stance or Tai Chi. And last but not least, these are the low impact cardio exercises. This could be swimming, cycling, or water aerobics. The key here is not to stress your joint and still get best for ensuring a good cardiac workout. Now you will see that all these 4 or 5 things that I've told are different, and people ask me what should I do. So I have got a lot of people who will only focus on a single thing. There'll be someone who is a very avid runner, a marathoner. It's good. I mean, it takes care of a lot of things, but it does not take care of all the things. It's just like having food, where you can have just one thing and feel that you are satiated, maybe a piece of steak. But the balanced food is the one which has got component of all of this. Personally, if you ask me what do, I try to walk 2 to 3 times a week. I try to do strength training. It could be weight training or even therabands once a week. I like to swim once a week. And of course, balance and stretching are incorporated in my daily routine only for 5 minutes. I think overall, if we have this, so flexibility and balance are simple things that you can do it in your room, your office, you don't need to set out a separate time for it. Walking, I think walking in nature for me is the best thing. It rejuvenates not only your body but also your mind. Strength training needs to be focused. You need to make time for it, and of course, swimming requires you to have an access to pool. But if you can do all of those, I think you need not have a very muscular body. You can have a little bit of pot belly to have, which I'm sure many of us have at a certain age. But it's important that you have a combination or right mix of all these 5 categories of exercising. Now, coming to lifestyle choices, I think these are also a very important aspect. So, there are 3 key things: nutrition, hydration, and sunlight exposure. In nutrition, it's important to have calcium, vitamin D, adequate proteins, magnesium, omega 3, vitamin C, and antioxidant. I believe that we'll have a talk on this subject separately, because it's an entire day symposium on how to do it. Just the key things are to have balance and variety, limit processed food, and supplement on the things that we usually do not have in our diet. These are typically calcium, vitamin D, and omega 3 fatty acids. Now, coming to things that we can do to prevent injury, and I think that's very crucial, because as an orthopedic surgeon, it's my duty to not only treat injuries but also to prevent them. So, some basic dictums. It's important to warm up and cool down. It's important to do strength training. It's also important that you have a proper form and technique, that you wear appropriate footwear, listen to your body. A bit of cross training and mix of all the exercises that we discussed is good. Have fall prevention measures. See areas where you work out. As you age, have adequate cushions, and of course, regular preventive checkups, especially things for osteoporosis like DEXA. Today we have that, and I think depending on your age and your previous DEXA, you can do it annually or biannually. So I think these are very crucial things to prevent injuries. Last but not least, when to seek medical help. If someone is having a persistent pain, swelling or bruising, restricted movement or weakness, numbness or tingling, any instability in the joint, unusual popping or cracking sounds, recurring issues, symptoms of infection, I think these are all indications that you require more specialized cares. And today, fortunately, as an orthopedic department, we've got ways and means to treat them in very simple fashions. With all the advent of robotic surgeries, arthroscopies, I think treating musculoskeletal disease have become much more rewarding and much more fun. To conclude, I would only give you this acronym: Beat the Aging. Beat stands for B, which is buddy, have a friend. It could be a real friend or it could be technology. I remember as a kid, we used to have friends who would be like chuddy buddies and will call anytime, Arey Vaibhav, kya kar raha hai? Come down, we must play cricket, padna chhod. And we would just follow it. And I think, unfortunately, as we age, such kind of relationship or friendship goes away. But if you can have a friend who motivates you, who encourages you to do exercises with you, please grab him by both hands. If not, use technology. I've got this Apple Watch. I've ditched all the Rolexes and Longines for this simple thing, because if you see, it's got 3 rings. Until the rings close, I don't try to. I avoid going to sleep. So even if I have my day is long and if I reach my home, and the rings are not closed, I would try to take a couple of rounds in my own compound to ensure that these rings are closed. Another thing that I've found, Sulas, and pardon me, Dr. Charu, is that whenever I go for any conferences or leave, they are my me time. They are time for me to reflect, meditate, and exercise and catch up on what I have missed. So I deliver my lectures, but ensure that those are the days where I kind of catch up on my exercise. The second beat out of beat is the early start. Start today. आज काल करे सो आज करे सो अब पर में परले होएगी भोरी करेगा आप. So good habits should start immediately. A stands for being consistent. Always be consistent. Always do the thing. That 6 out of 7 days there will be a cheat days. Try to incorporate a good healthy fitness regime in your day-to-day activity. And T stands for time. You must give at least 20 minutes per day to ensure that you have got the real results from this. Thank you for your attention, and I really appreciate and thank all the organizers for this wonderful wellness program. Please feel free to ask any questions that you may have on this subject.